The rising popularity of vaping has been dramatic, especially among teenagers. According to a recent study, about 37% of high school seniors reported vaping in 2018. That is up from 28% the year before. An estimated 2.1 million middle school and high school students reported using e-cigarettes in 2017. That number jumped to 3.6 million in 2018. Certainly, age restriction, it's illegal to sell e-cigarettes to anyone under 21, 18 or 19 years in some states are not preventing use among teens and young adults. And nearly 7 million adults 18 or older use e-cigarettes according to a 2017 survey by CDC. You may have seen news reports of lung problems, including death, linked to vaping according to the CDC. Many e-cigarettes users have developed severe lung disease in 22 states. A Washington Post report and put the number at 354 deaths. Most cases were among teens and young adults. Probably, education is our best way to fight against vaping and prevent our future generation from further harm. That's why we are discussing this subject today with our expert, Dr. Jim Tita, the Chief Medical Officer at Mercy St. Vincent, a critical care specialist and pulmonary specialist.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
At Ballast Buick GMC, you can make luxury your reality in an all-new 2017 Buick LaCrosse, designed for the ultimate quiet and luxurious driving experience. Or picture your family in a luxurious, roomy SUV, complete with DVD system, heated seats, and a 4G Wi-Fi hotspot. Choose from the popular compact Buick Encore to the gorgeous Buick Enclave. We invite you to browse our website, ballastbuickgmc.com, or stop in soon. Remember, at Ballast, you are family.
Welcome to our show. Thank you, Dr. Tita, for being here. So can you tell us why are the smoker in reality wants more and more cigarette? I mean, what's kind of mechanism which is forcing them technically to ask for more and more and even go for the e-cigarettes and continue smoking after that?
Well, that's a great question because, you know, conceptually you would think that, you know, if you give somebody nicotine through their skin or they get it through their mouth, that this is nicotine. Why doesn't that satisfy a smoker? What is it that smokers find so pleasurable? And we believe that it's the tremendous absorptive capacity of the lung. If when you inhale nicotine, the absorptive capacity of the lung is such that the nicotine travels from your lung to your brain quicker than if you injected it into your vein. And it's that surge of nicotine that presumably smokers find so pleasurable.
And that's true probably for the illegal, or
indeed,
now in some
indeed.
of the substances is legal.
Indeed, whether it be cocaine or any of the other substances that people abuse by inhaling.
Absolutely. So Jim, how did we come to this from cigarette to e-cigarette, and what are the medical concerns we have?
Well, e-cigarettes are a device that uses water vapor to deliver substances to the lung, and most specifically nicotine, although certainly not all electronic cigarettes contain nicotine. Some of them contain no nicotine at all. Others are flavored. There can be a combination of the two, but rather than using combustion, which is something burning and smoke, they use a liquid vapor to deliver a substance to the mouth and lower airways. And they've really become popular probably in the last 5 to 10 years. They've been marketed heavily, especially to teenagers. And they've also been marketed as a safer alternative to cigarette smoking. But actually, we don't know that that's true. We certainly don't have long-term studies. And as recent reports have indicated, there may be some even potentially life-threatening complications of using e-cigarettes.
Based on the current circumstances and the cases reported and from your personal experience, can you recommend e-cigarette to someone who wants to quit smoking?
I would say with what we know right now, the answer would be no. Certainly people have been using e-cigarettes. And as a pulmonologist, I mean, I have patients who have used them to try to quit smoking. We don't have really good data on that. It's my impression that it's probably not much better than any of the other methods that we have to quit smoking. And certainly with the health risks that we're aware of now, I would recommend to my patients that they not use e-cigarettes.
So there is a misconception that vaping is a healthy alternative to smoking. What are the health concerns to anyone who vape, especially for the younger generation?
Well, the biggest health risk is the addiction to nicotine. Nicotine is a very addictive substance, and especially to teenagers whose brains are very susceptible to the addictive effects of nicotine. This acts as a gateway eventually to them being addicted to nicotine potentially for the rest of their lives. From my perspective, I mean, that's the biggest health risk. We don't have a good idea exactly what chemicals people are inhaling, and so the long-term risks of some of these things are not clearly known. For example, in the acute lung injury, the pneumonia type illness that has been reported in people that have smoked e-cigarettes, one of the substances which has been implicated has been vitamin E acetate. Vitamin E, when used in lotions for the skin or even in foods, gets degraded by the body, but when you inhale that substance, the lung has no way of actually metabolizing it, and it can actually cause an injury to the lung, and we believe that at least in some of these cases that potentially is the causative agent. So right now those are the biggest dangers, and then as I said, the long-term effects are just not known.
So as preventive measure now, when we are talking about the teenager who already start doing vaping, and what are the family things which they can do, the school, what they can do, the community, what can we do to help them to quit or to stop doing this dangerous stuff?
Well, you know, I would speak with your teenager, try to impress upon them that not only is this dangerous, the biggest danger is the addictive potential. And unfortunately, I mean, at that age, teenagers feel invincible, but once they get over that, unfortunately, they're addicted, and that's what the real danger is. I know these things are banned in schools. Unfortunately, as I said, it sort of becomes a cat and mouse game, and so sometimes it's difficult to police. But I would just be very open and honest with your teenager in explaining to them how risky this is from an addiction potential.
And the more information probably we provide in the community, in the school, in the house, and talk about it, I mean, that will help to determine basically the best possible way. I mean, even if we get 1 kid out of 10 to quit, that's a success. So I have no doubt by more information, more knowledge we provide, and that's why we are doing this episode, to educate our viewers and inform them about this danger of vaping and how important to help our kids to stop doing it, because that will help everyone. Based on what you heard from patients and what we know currently, can you tell us why the patients believe e-cigarette or vaping is a healthy alternative to smoking?
Well, we've certainly known for many, many years that cigarette smoking is associated with lung cancer, cancer of the mouth. It's also associated with chronic obstructive pulmonary disease, and it was felt that a lot of the substances in cigarette smoke which cause those diseases were related to the burning of organic compounds, the tobacco, the paper, and so this was viewed as something that takes that combustion, that burning away, and you're just dealing with the nicotine. Nicotine, however, in and of itself is a toxic substance. It causes constriction of the blood vessels, speeds up the heart, can affect the gums. It has a lot of adverse effects in and of itself. And as I said, once you become addicted to nicotine, and certainly any smoker can attest to this, it's very, very difficult to stop.
Anyone who is watching the news knows that vaping is hurting young adults. How are these young adults more susceptible to harm from the e-cigarette and vaping comparing to general adults? Can you tell us what is the appeal for the teenagers in that regard of vaping? I mean, why they are doing it?
Well, probably for a variety of reasons, this has been very appealing to teenagers. You know, smoking in general is that age-old tension between conformity with your peers and rebellion against your parents. And I think e-cigarettes have sort of been a modern twist on that. And so it's been very appealing to teenagers. Like teenagers, sometimes they have difficulties setting boundaries and limits. You know, 1 Juul cartridge, for example, in terms of the amount of nicotine is equivalent to about 200 cigarettes. And, you know, we hear reports that some teenagers are going through 1 of those a day. So that's a lot of nicotine. Not only that, as I mentioned, the teenage brain, which is still developing, is very susceptible to the addictive effects of nicotine. It's felt that nicotine irreversibly changes their brain chemistry, and that's of course why it's so difficult to quit. I know from a school standpoint that it's difficult to detect. Certainly if you're smoking, you leave evidence of that with smoke, something you can see, something you can smell, but with vaping, it dissipates almost instantly. And so it almost becomes kind of a cat and mouse game. And so a lot of these things have an appeal to teenagers. The other thing I will tell you about the vaping-associated lung disease is a lot of these cases were people that were vaping THC, which is the active component in marijuana. Now, these were not necessarily vapes that were commercially available. They got them online, they got them from friends, associates, whatever. And again, I mean, this is even less regulated than conventional vaping. We have absolutely no idea what was in some of this stuff, but the majority of cases seem to be associated with THC or THC and nicotine, although a handful have been reported in people that reportedly only used nicotine. So, and again, this has afflicted primarily younger people less than 20% of cases have been reported in people more than 30 years old. Now, whether this is just the population that has been doing this, or whether there's something about their lungs that make them more susceptible, we don't know the answer to that.
We know that it's not only the nicotine in cigarette which is really the dangerous item, but also there's some additional chemicals, including pesticide and pneumonia. So what about the e-cigarette liquids or the other items in chemicals in the e-cigarettes liquid, which is sometimes it's dangerous, and we need to let the people know about that?
Well, we don't completely know. Again, these are not regulated like pharmaceuticals, and so the disclosure is never complete. We know a lot of them have propylene glycol, which is part of that liquid. Propylene glycol is it's a vehicle, so it's not actually a filler, but it's a liquid that carries with it other substances, and so it's put in the e-cigarette to facilitate the vaporization of nicotine. We also know that vitamin E acetate was in some of these. Flavorings, there are a number of flavorings that are put into these cartridges. So again, I mean, there's just a lot of unknowns here.
Where do you want the research to go so the information will be out there for all of the teenagers to stop hurting themselves?
Well, I think what we need to do is put a ban on e-cigarettes, or at least a moratorium, until we can establish their safety. You know, from my perspective, as I said, the biggest risk is the risk of addiction. And you know, from that standpoint, I mean, I'm not sure at this point, from our current perspective, that we can necessarily make these devices safe.
How do you feel about this, the idea of banning the e-cigarette or the vaping at this point? We know that it's specifically for age-related issues. And they are talking about this is going to promote the black market sales for these kind of product, where the people, they will demand it more, right, just because it's illegal.
We do know that you know, when you ban something like this, that obviously it fuels a black market. And in many of these vaping-related lung injuries, these were vaping devices that weren't available commercially. I mean, and I'm not exactly sure where they're coming from, but they are available, so undoubtedly that would happen. I think what we need to do, though, is regulate them. Make sure that we can keep them out of the hands of teenagers, or at least do our best that we can, and really try to limit their use rather than expanding their use.
Can you tell us about some of the reported injury cases coming from vaping locally?
We have had reported cases here in the Toledo area of vaping-associated lung disease. This is now a reportable disease. We are required to report cases to the Ohio State Board of Health. So we keep track of this like we would other diseases. And, you know, I think we certainly probably even have more cases than we've realized, just because this has been a relatively recently described syndrome. And so probably the harder we look, the more we will find of these cases.
So since these vaping injury relatively are new things in medicine, and the treatment is still somehow limited, what are the risks exposed to the people when they are coming to you and they are vaping and they have some injury? What are the risks exposing those people when we are offering those treatment to them?
Well, I think the most important thing is to ask patients about their vaping history. And it doesn't necessarily mean that they vaped the day they present with symptoms. I mean, the typical profile is somebody who's vaped within the last 3 weeks. They may have sort of flu-like symptoms, so nausea, vomiting, maybe low-grade fever. Shortness of breath is of course, one of the signs. And then when you get a chest x-ray, you see what looks like pneumonia or infiltrates. There's no specific blood test that necessarily allows you to make the diagnosis. It's a constellation of signs and symptoms. The treatment now is recommended to be steroids or prednisone. Again, we don't have good studies to necessarily show that this is the correct treatment. On the other hand, of those people that have recovered, steroids seem to hasten their recovery. But there are people that progress to the point of death. There was one young man who was transplanted up in Detroit who was treated with steroids, obviously didn't get better, and his disease progressed. So right now the optimal treatment is not known, and it'll await further studies and experience.
If there is any positive things from the e-cigarettes?
I certainly have had patients who have quit smoking cigarettes using e-cigarettes. Now the theory is that they cut down the amount of nicotine in their e-cigarettes until they're off the nicotine, but the statistics have shown that about 80% of patients continue to smoke e-cigarettes with nicotine. So they're substituting the nicotine in the e-cigarettes for the nicotine that they were getting in regular cigarettes. And undoubtedly, all the combustible products that are present in cigarettes do have an adverse effect on your health. The carcinogenic potential of the burning materials, destruction of lung tissue, all of those other things that occur. The carbon monoxide that is generated with burning. So in that sense, I mean, it may be better. But on the other hand, I mean, the nicotine in and of itself is a dangerous and addictive substance.
So that brings us back to the original idea, which is quit smoking. It's very important no matter what.
Correct.
And there is some alternative to help the people to quit smoking at this point. And probably with the current scenario of what's going on with the e-cigarette and the vaping and the danger of which is now well known nationally, maybe we should go back to the old system and start talking about the nicotine patch and about the
yes.
Gum and try to help the people, because the purpose it still is to quit, not to continue, because what you suggested, 80% continue smoking, unfortunately.
Right. Indeed, and what I typically tell patients is there's no one single method that is effective for everybody. And you know, we have some people that go cold turkey. Probably the majority of successful quitters go cold turkey. You can use nicotine replacement therapy, which vaping would be one, and there's the nicotine patch, the nicotine inhaler, the nicotine gum. You can go with medications like bupropion or Chantix, which work on the brain to block those nicotine receptors. There's hypnosis, acupuncture, so there are a lot of different behavioral methods. But again, what works for one person may not work for another. And I think there is some merit to having sort of a palette of options available for folks. Most successful people, before they quit, try a bunch of times and fail. And so it takes a while for something to click. And everybody quits for their own reason. And once those things kind of work out, people are able to quit. But quit rates, long-term quit rates are not good. And most smokers who start smoking die smoking.
That's why we recommend for the people not to start smoking as the most important
Correct.
message. Thank you very much. We appreciate all of the information, all of the knowledge which you provided us, and I hope it's going to help everyone to understand that vaping is dangerous and it's about time to stop. Thank you very much, Jeff.
You're welcome, Ameer.
Life is filled with uncertainties. Your career, your health, your family situation, they're all subject to change. So how can you plan for your future when you don't know what it will hold? The Root Prisby Williams Group, a financial advisor team at Morgan Stanley, can help. Joel, Jim, and Deb will work with you to create a wealth plan and to help you manage your investments through all the changes. And the great thing is they're right here in Northwest Ohio. To make an appointment with Joe, Jim, and Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney LLC, member SIPC.
Honey, do you remember this mole being there before?
No, I don't. We better get that checked out. I'll call Renaissance Dermatology.
Didn't they treat your eczema?
Yeah, but they can handle the full spectrum of skin conditions. They can screen to see if it's a problem, and if it is, they can handle the surgery too.
Will it take long to get an appointment?
No, Renaissance Dermatology is timely and efficient. That's why I trust them.
Sounds like they know what they're doing. Go ahead and call.
5951 Renaissance Place in Toledo. Call 419-824-2288 for an appointment. Renaissance Dermatology.
What's clear is that there is a lot about vaping we don't know. One way we will learn more is by people reporting possible vaping-related health problem to the FDA. You can let them know if you have had such a problem. Until we know more, think twice about vaping. Federal and state authorities recommend avoiding all vaping until more is known. These cases of severe lung disease among people who vape raise important questions about the safety of vaping. Perhaps we should not be surprised that lung problem might develop in people who vape. Our lungs were meant to inhale clean air and nothing else. It took many years to recognize the damage cigarettes can cause. We could be on a similar path with vaping. Let's not go down that same path, because remember, time waits for no one. Good evening.
Get caught up and educated with past episodes of Time Waits for No One. Go to YouTube and search for Toledo Cardiology Consultants to find our channel. Then click to subscribe so you never miss an episode.
Remember, time waits for no one.